Hi, I'm Nora Doherty. I'm going to be talking about in the next few slides the application of Jean Watson's theory in nursing. I will be using the 10 Caritas processes developed by Jean Watson. So I will present a clinical scenario and then an encounter between a nurse and a patient to help show how Jean Watson how a nurse can utilize Jean Watson's 10 Caritas processes. So the clinical scenario is about a patient, Lydia, who is 45 years old, who recently underwent a modified radical right mastectomy with axillary lymph node dissection for stage 3 locally advanced breast cancer. This is post-op day number 2 for Lydia, and Rose is the nurse who will be caring for her until she discharges later on today. The backdrop before the encounter will be that nurse Rose notices that Dr. M, Lydia's surgeon, is in the room with Lydia and quickly moves towards her to be able to be there with her for the encounter with Dr. M. Earlier in the day, Rose was able to realize that this encounter that Lydia was having with her surgeon was going to be very anxious for her. She was really anxious to have this meeting and noted earlier that she wanted to try and be present for that visit. When the encounter starts, Rose is entering the room and notices that Dr. M is actually leaving when she gets there, and Lydia is crying and very upset. Rose then asks Lydia if there's anything she can do to help her, and that's when Lydia breaks down and says how overwhelming it was to see her incision and really fully processing the fact that she no longer has that breast, and not only that, that she is anxious about what the future holds with chemotherapy and reconstructive surgery. And it is at that point that Nurse Rose grabs a stool and sits right beside Lydia at eye level and is able to ask her, say how difficult she understands that Lydia must be feeling, and then ask her if she would like to talk about it. So in this side, there are 3 Caritas that are utilized. The first one is actually Carita number 3, which is cultivation of one's own spiritual practices and transpersonal self going beyond ego. And so Lydia utilized this by recognizing that, or Rose utilized this by recognizing that Lydia was going to be very anxious about her encounter with Dr. M, the surgeon, and she really wanted to be there for her, to be supportive to her when the doctor arrived. Although she missed him, she did try to make that a goal to be there with her. So that's how she utilized Carita number 3. She then utilized Carita number 4, which is development and sustaining a helping and trust-caring relationship. She's able to utilize this Carita because she took a stool and sat at eye level with Lydia. And by doing this, she's proving not only how important Lydia's feelings are, but that Rose truly cares. And so she's developing that trust-caring relationship with the patient. And then the final Carita utilized in this slide is number 5, which is being present to and supporting of the expression of positive and negative feelings. By stating to Lydia, this must be really difficult for you, reiterates that Lydia's feelings are very valid and that Rose wants to support her by being available and sitting and listening with her. And so that's the end of this slide, and we'll move on to the next.